In this audio, I will provide an overview and directions to the case presentation assignment. For this assignment, we have covered each of the sections you will need to complete with the exception of treatment planning. We will be covering that topic in class soon. Please note, I do encourage starting this assignment soon as it is a long assignment. The general directions are provided here and match the information I have placed in the case presentation assignment folder. As noted here, this assignment is meant to be a continuation from the core function assessment assignment, as you will be building on your assessment skills to develop a client's full case presentation file. You will create a hypothetical client and complete a profile of your client from assessment through discharge. For this assignment, you have the option of using Allen from the core function assessment assignment video or creating your own client. If you use Allen, the expectation will be to add more information to complete a full assessment. Your typed case presentation will include the following sections. Section 1, Client Information and Cover Sheet. Section 2, Assessment, meaning fully completed assessment domains. Section 3, Clinical Impressions from the assessment, meaning a fully completed brief MSE and diagnostic information taken during the assessment session. Section 4, Treatment Plan, and Section 5, Course of Treatment and Discharge Summary. And you will be using the templates provided in the case presentation assignment folder to complete each of the above areas. Please make sure to address each area of each section using the appropriate documentation techniques discussed in class. If you need more information on each of the components, please refer to the following class information folders posted here and in the assignment. Lastly, I have included a mock presentation to view in the case presentation assignment folder. Use this to make sure you are on track with how your case presentation should be formatted. In addition, please don't hesitate to let me know if you have any questions about any of the sections. Next, I will give a brief overview for each area. To start with, you will be using this form for Section 1 and will provide the basic admission information for your client. Please fill out each area as well as include your own name at the top. Next, we have Section 2, the assessment domains. On this slide is only a partial list, so please make sure to download the full template provided and complete all domains. If you plan to use Allen, the idea is that you would imagine having a follow-up appointment with him to gather the missing information in order to complete a full assessment. In addition, please remember to use the proper documentation techniques, client reported, client stated, client expressed, throughout all the assessment domains. For Section 3, Clinical Impressions, you will be completing all the sections listed here. Please note that you will be doing a full brief MSE and completing a full substance use and addictive disorder diagnosis using the DSM-5 criteria. For the DSM-5 criteria, please feel free to identify the criteria you selected here or attach the DSM-5 form indicating in bold the criteria you selected. Please make sure that the criteria that you select here matches what you have included in the assessment domains. Meaning, if you select criteria number 2, I should be able to easily identify that criteria in one or more of the assessment domains. This is to ensure that there is consistency between what is written in the assessment with what is listed for the substance use and addictive disorders diagnosis. Lastly, in addition to the criteria, you will be noting if the disorder is in a mild, moderate, or severe type. Again, that would be mild, moderate, or severe type. Next, Section 4, the treatment plan. The plan listed here is only a partial plan, so please make sure to download the template provided and include 2, not just 1, focus areas. More information and detail for completing this form will be given when we cover this topic in class. Lastly, you will be finishing the case presentation with Section 5, Course of Treatment and Discharge Summary. Here you will complete 3 areas. First, a brief overview of what the client worked on during their treatment sessions and their progress and/or completion of treatment goals. This is meant to be an overview of their general course of treatment. Second, you will list the reason for discharge. Here you can include a brief explanation related to the discharge. And third, you will include the aftercare/recovery maintenance plan you recommend the client to use after the formal discharge from treatment services. This covers the overview of the case presentation assignment. Again, please feel free to review the mock example I provide, as well as let me know if you have any questions. As always, I'm happy to help.